Mythbusters, the flu. First, let's start with the basics. What is the flu? The flu, also called influenza, is a highly contagious virus that causes mild to severe illness lasting between 1 to 14 days. It affects the nose, throat, and lungs along with other systemic symptoms. Occasionally, the flu can result in worsening complications and even lead to death. It is important to note that the flu is caused by a specific virus that is different from the common cold and can change each year. Finally, make sure to get ready because flu season is coming up soon and generally lasts from October to March. So how do you know if you even have the flu? Common symptoms are fever, chills, cough, sore throat, congested nose, body aches, fatigue, vomiting, and/or diarrhea. While some of these symptoms might not seem severe, complications can be severe. The flu can lead to pneumonia, sinus infections, or organ failure. As straightforward as the flu may seem, chances are you have had the flu and received advice from family and friends on how you got it, how to treat it, and so on. But is what you're actually hearing true, or is it a myth? Let's find out. Here is a list of common myths about the flu.
Hi Monica, I'm here to give you your flu shot.
I'm actually feeling okay today, so I don't think I'm going to get it.
Well, you should get it. They recommend that everybody should get it so you can be prevented from catching this contagious virus.
But I hear you get sick from the flu shot.
You won't get sick from it. It's inactivated. All it does is teaches your immune system to recognize the virus so you won't get sick.
Okay. Oh, that wasn't so bad.
Good.
Thank you.
You're welcome. You're one step closer to not catching the flu.
As you saw in the video, the flu vaccine is commonly misunderstood. The truth is, the viruses in the flu shot are inactivated, so you cannot become infected from them. Instead, they help your body build an immune defense against the actual flu virus. Side effects of the flu shot may include soreness or redness at the injection site and/or a low-grade fever. Remember, just because you aren't sick now doesn't mean you don't need the flu shot. Even healthy people need the flu vaccine to prevent getting the illness. Finally, want to make sure you remain healthy even beyond getting a vaccine? Keep your immune system healthy with diet, exercise, and sleep. As always, wash your hands.
Sorry, Frisch, I've been feeling so sick lately. My body is aching and I have the chills and I just feel so tired.
Oh no,
I think it's just a really bad cold though.
Okay, let me see your look. Oh, you're hot. Maddie, I feel like you need to go see doctor because if it's not a cold, it might be flu, and flu is very serious and has much more complication than the cold.
Oh, really? Maybe I should go see the doctor then.
The truth is that the flu isn't the same thing as the common cold. The flu can be much more severe than the common cold and ends up hospitalizing over 200,000 people each year and killing around 36,000 people a year in the United States. Trying to figure out if you have the flu or the cold? As you can see on this screen, there are several differences in symptoms. If you're still worried, always consult your healthcare professionals.
So yeah, I heard the flu's going around.
Yeah, my sister's actually had it, and my mom's been starving her for the past 3 days, so I had to sneak her some food last night, and we were sharing it.
Oh, I'm sorry about your sister, but you guys, this pumpkin spice latte is so good.
Yeah.
Oh my gosh, I've never had it before. Can I try?
Yes, have some.
Are you guys crazy? She just got done telling you she's sick.
Oh, no, I'm not sick. I don't have any symptoms.
No, but if you did get sick from your sister, you're actually the most contagious before you have any symptoms.
Oh yeah, so stay away, Jeremy.
Yeah, don't share with me either.
Don't let how you feel fool you. You can spread the flu even if you don't have symptoms. You are actually most contagious in the first 3 to 4 days after initial infection, whereas symptoms don't usually start until day 2, meaning you may be able to pass the flu on to someone else before you actually feel sick.
Hey, the clinic downtown is giving out free flu shots if you want to go get ours.
I don't need it. I had my flu shots last year.
Oh, well, you should get your flu shot every year.
No, I don't need it. I feel like I'm protected.
Well, actually, your body's immune response to the flu shot, it declines over time. And also, the formulation changes each year as well, so you should get yours updated.
Wow, I didn't know that. Then let's go and get our flu shots. I don't want to miss any clinical days.
Yeah.
Yay.
As seen in the video, the fact is that you should get your flu shot every year, prior to the start of flu season. This ensures an optimal immune response, which gives you your best chance at not getting sick. Also, it is important to note that the flu virus mutates every year, so each year the flu vaccine is adjusted to compensate for those changes.
Burr, it's so cold outside today. I better bundle up so I don't catch the flu. There, now I won't get sick.
In reality, catching the flu is completely unrelated to the weather outside. The only way to catch the flu is to be exposed to the influenza virus. The belief that you will catch the flu if you go out in the cold without a jacket or with wet hair originates largely due to the fact that flu season happens to coincide with colder weather. This is purely a coincidence.
Hi, honey, how are you feeling?
I feel sick.
You're not supposed to be eating.
But I'm hungry.
Remember we were taught, feed a cold, starve the flu? Honey, you have the flu. You should not be eating. I'm going to take this away, okay?
Most people don't feel like eating much when they don't feel good. If you're hungry, eat. But no worries if you don't. What's most important is fluids. Did you know that when your body fights an illness, it needs energy? For each degree of temperature rise, the energy demand rises further. Taking in calories become important. Fever dehydrates your body, in part by increased sweating and increased temperature. Replacing fluids is critical to help the body fight infection. The same is true for combating colds. Bottom line is don't force yourself to eat, but drink.
I feel so tired and I feel miserable. I don't know what to do. But I have the chicken soup and this is my chicken soup. After I eat it, I feel better.
The facts are that hot fluids like chicken soup or tea can soothe some of the symptoms of a flu, like a sore throat, as well as provide you with extra fluids. However, chicken soup itself does not contain anything within it that will help you fight off the flu.
Hello? Is this Dr. Patel's office?
Hello, yes, this is Dr. Patel. How can I help you?
Oh gosh, I feel so sick today. I think I caught a bug. I have a fever since last night. My body aches. And I have a runny nose. I have coughing. So can you give me like an antibiotic or something?
Hi, yeah, I'm sorry to hear that. That sounds horrible. But I'm sorry to say I can't prescribe you any antibiotics. It sounds like you might have the flu, which is a virus. And antibiotics only treat bacterial infections, so it won't really do anything for you. What I can recommend is if you get plenty of rest and drink lots of fluids, the virus just kind of has to run its course, but your immune system will do all the work. But if it lasts longer than 7 days, you can come in and see me and we'll see what we can do for you, okay?
Okay, thank you. Bye-bye.
Bye.
Antibiotics are not effective against the flu because the flu is caused by a virus, not bacteria. Taking antibiotics can actually cause unnecessary side effects, have the potential to trigger allergic reactions, and might cause long-term antibiotic resistance. Now that we've busted the common myths about the flu, you may still be confused about what actually is recommended to help prevent and treat the flu. Here are the main guidelines provided by medical professionals. If you don't want to get sick in the first place, there are several things you can do to increase your chances of not catching the flu. First, get the flu shot. According to the Center for Disease Control, the #1 way to prevent the flu is to get the flu shot. Second, wash your hands. The flu spreads via tiny droplets of fluid that come from the respiratory tract of people around you who are sick. By washing your hands before meals and avoiding touching your eyes, nose, and mouth, you decrease your chances of taking in the virus. Last, avoid close contact with ill family members or friends, and be sure to disinfect surfaces that are likely to become contaminated. Finally, what do you do if you do catch the flu? Most of treating the flu can be done from home. General recommendations are to stay home and rest, drink plenty of fluids, take over-the-counter medicines that lower your fever, such as acetaminophen or ibuprofen, and take any medications provided to you by your doctor as soon as possible to lessen the symptoms of the flu. As we have said before, the best way to treat the flu is to prevent it. So if you're interested in getting your flu vaccine this season, there are several low-cost and free options for you. First, check through your healthcare provider or health clinic. Large healthcare providers like Kaiser and Sutter may have free flu vaccine clinics in your area. Next, for low-cost options, check your local pharmacies like CVS and Walgreens, as well as Costco. Finally, check through your employer. Some employers will provide low-cost or free flu vaccines in the office, or they'll tell you where you can go get one. If you want the most up-to-date information on the flu, then go ahead and visit the CDC at https://www.cdc.gov/flu/index.htm.